Hi, my name is Beverly Owens. I'm an 8th grade science teacher in North Carolina. I'm also a graduate student at Mississippi State University studying environmental geoscience through distance learning. Since I'm a teacher, I'm able to telework during this COVID-19 pandemic. I can video conference with my students, and I've built my instruction within the Canvas learning management system. However, many people are considered essential workers, and they still report to work on a daily basis. Certainly, healthcare workers are necessary in helping our communities to overcome this pandemic. But I started reading articles about how many healthcare facilities are experiencing shortages of personal protective equipment or having to reuse face masks by storing them in brown paper bags. I began wondering if there was a way that I could contribute. I researched different designs of STL files and talked with healthcare workers and decided to print some different PPE prototypes. For now, my dining room has been converted into a 3D printing workshop. I have been using 3 MakerBot printers to produce equipment for local healthcare facilities, local hospitals, doctors, nurses, and immunocompromised individuals. I've been using a desktop replicator to produce visors and masks. The masks provide an extra layer of protection when worn on top of a paper or cloth mask, or a bandana, and are intended to prevent the accumulation of pathogens on material that is against the face. Face shields have also been popular with many area doctors and nurses. The face shield is made of a 3D printed visor that attaches to a clear plastic sheet, like acetate or Duralar. This provides extended coverage of the face, allowing for a paper or N95 surgical mask or even goggles to be worn in tandem with the face shield to prevent aerosolized pathogens from getting on the face. My 2 MakerBot sketch printers have been making ear guards. The ear guards attach to mask straps behind the head to prevent sores from forming around the ears. After selecting the files that I wanted to print, I made some adjustments using Tinkercad and then imported the file into MakerBot Print. I tweaked some print settings and then the file was rendered or sliced for the replicator and sketch printers that I'm using. When the file is selected to print, the extruder heats up. It begins melting the filament. This filament is PLA, or polylactic acid plastic. This material is cornstarch based and it smells sweet when it's being heated and extruded. The filament is deposited one thin layer at a time and continues being built vertically until the object is complete. One of the beauties of these machines is being able to click print and walk away. The other day I was cooking dinner and I was able to use the built-in webcam to watch the current print being produced. So far, I have produced about 250 pieces of PPE gear, and I'm providing them to individuals and facilities in my area free of charge. If you have access to a 3D printer, or you know someone who does, producing personal protective equipment using this technology is one small way that we can help the medical community during this pandemic. It is a small act of kindness that can help mitigate PPE shortages and help keep essential workers safe as they assist others in need.